Hi, my name is Diana Budkowska, and I will be discussing our poster on addressing health disparities, race, and racism in orthopedic journals, which is a scoping review. Awareness of health disparities and racism in scholarly publication has increased in recent years, and most recently after COVID-19 pandemic and the justice protest in the summer of 2020. Scoping reviews to assess the degree of discussion of topics such as racism and health disparities in literature have been conducted in fields like emergency medicine, but haven't been conducted in orthopedic surgery. So the study aims to elucidate the current state of academic discourse on these issues in orthopedic surgery to see what are the areas of further improvement. We conducted a comprehensive literature review, including multiple databases, with our research strategies focusing on the topics like racism and health disparities to identify studies on these topics in the United States-based orthopedic journals from over time period from 2014 to 2024. We had independent researchers review the articles that we found to verify that their articles did discuss health disparities or racism, and later we included the screen articles and recorded them by the specific journals they were published in, what specific health disparity they discussed. We have found 333 articles from 69 orthopedic journals that either directly examine health disparities or racism or included related variables in their studies. These articles comprised only 0.5% of published literature within those journals. However, we do see that the numbers of articles including these topics are on the rise, with the most growth occurring after 2022, which can be seen on Figure 2. Of the screen articles, we did see that race and ethnicity was the most studied variable as compared to gender, social needs, geography, insurance type. And we also see that coverage of race and ethnicity has also increased the most within the period of 2014 and 2024. Of the 312 articles that involved race, 58% of those 312 included it just as a demographic value, versus the 42% of studies analyzed race as the main part of the main focus of their study. We created 5 categories for these race-focused studies to fall into, with the largest category being race and patient access or outcomes with 34.6%. So with our analysis, we do see that the number of articles addressing health and race disparities in orthopedics is on the rise, but the total number of publication is still disproportionately low. This notable change in the number does reflect the social events in the 2020. However, there is a still notable scarcity that needs to be addressed. Thank you.